Yeah, and Dr. Kelly Zock joins us now. Dr. Zock, thanks for so much. I mean, we saw Adrian, she's 38 years old. Who's your typical back pain patient?
Yeah, so back pain is so prevalent that we just don't see a typical back pain patient. We see patients that are in their 70s, 80s, 90s who have back pain because they have degenerative spine conditions. And then you see patients like Adrian in their 20s, 30s, or 40s who have back pain because they work a stressful job, physically stressful job, or they're genetically predisposed to having back pain, or maybe they just have an injury or accident that's impacted their back. So there really isn't a typical back pain patient.
Right. As a hospice nurse, she was lifting a lot of people. Is it related to lifestyle ever?
Yeah, certainly. And there's factors that are controllable, and then there's factors that aren't controlled that contribute to back pain. So the controllable factors would be things like, our lifestyle. Do we sit too much? Our body weight. Do we not exercise enough? And then there's things that are not under our control, like aging and injuries or genetics that contribute to back pain. So there really are a lot of factors that contribute to low back pain.
Right.
So if you have all these factors going on, and maybe you have someone who is sedentary or has an injury, are they the best patient for this new procedure, or should you want somebody who's more active?
Well, a lot of these patients are very active, but typically these patients are going to describe low back pain right along the axis of the spine. And they can't sit for very long. They can't stand for very long. When they bend down or lean forward to pick up their kids or whatever, they have increased back pain. And then we get this MRI that demonstrates these kind of, degenerative changes within their discs and their vertebrae, and that's really causing that kind of axial low back pain.
Prevents you from moving anyway. You don't want to exercise when you're in pain like that.
Exactly.
Would you say that patients are more eager these days to try treatments that don't involve daily medication, pills?
Yeah, I think so. Historically, we really only had medications and very basic injection type treatments for back pain when it was non-surgical back pain. And now over the last 10 years, we've really seen an evolution on new kind of innovations in spine care. And so patients see that and they recognize that there are other things out there and they don't just have to, rely on medications to necessarily mask the pain. And they're more open to kind of pursuing these newer treatments.
It's very intriguing. Dr. Zock with Innovative Pain and Spine Specialist. Thanks for the information and good luck.
Thank you.